Hi, I'm Carrie Sawtell, licensed acupuncturist here at Many Rivers Community Acupuncture. And today I'm going to talk to you about how traditional Chinese medicine understands long COVID and the steps you can take to treat it at home if you do have long COVID. But first of all, our most important weapon in preventing COVID and the development of long COVID is to get vaccinated. So please make sure you are fully vaccinated so that we can win this fight. And I also wanted to give a special thanks to the Gateway Clinic and the Jade Screen Project in the UK. They have been providing traditional Chinese medicine services to frontline workers throughout this pandemic and have shared their experiences with us so that we know what we can do to help prevent and treat long COVID. First, it's important to understand from both a Western and traditional Chinese medicine perspective that COVID-19 is not simply a respiratory disease. The virus binds to the ACE2 receptors, which line our lungs, heart, blood vessels, liver, kidneys, and gastrointestinal tract. It binds to the endothelial and epithelial cells. And when it binds to these cells, it causes inflammation and cell disruption. This is why long COVID can not only cause respiratory issues, but can also cause issues with the heart, the liver, the kidneys, and the gastrointestinal tract. We know from Western medicine that it's this inflammation that causes all of the dysfunction in the cells and can lead to long-term complications even after the virus is gone. In traditional Chinese medicine, we call this a lingering pathogen. The pathogen itself, say a virus or bacteria, may be gone. However, the symptoms and problems that arise because of that pathogen continue. And in fact, it was about 2,000 years ago, plus or minus, that the ancient Chinese scholars first described this term of lingering pathogen. So even though the COVID-19 virus is a new coronavirus, Chinese medicine has been treating lingering pathogens for centuries. So traditional Chinese medicine offers 3 steps for helping to treat any lingering pathogen. The first step is to heal the gut. As I mentioned, the COVID-19 virus attacks the endothelial cells which line our digestive tract. This leads to inflammation of these cells so that they can no longer absorb nutrients properly. And unfortunately, it can also lead to a buildup of unhealthy bacteria in the gut. So the first step is to heal your gut. And you can do this by following an anti-inflammatory diet for at least 1 month, but 3 months is better. And an anti-inflammatory diet is a diet that is rich in antioxidants and polyphenols, which have been proven to help heal those endothelial cells lining the gut. And I have a handout in the YouTube comments section that shows a very easy anti-inflammatory diet for you to follow. And better yet, we can tweak the anti-inflammatory diet according to traditional Chinese medicine principles. So in traditional Chinese medicine, the digestive tract is controlled by the spleen organ. And to heal our digestive tract, we can follow the traditional Chinese medicine spleen diet. The first part of the spleen diet is exactly the same as the anti-inflammatory diet, which means to eliminate any fatty, fried, and greasy foods that will cause inflammation. The second part is to increase the bioavailability of the food we are ingesting. And we do this by cooking our food. Although raw foods, such as raw fruit and raw vegetables, do contain more nutrients than cooked foods, raw foods have cellulose in their cell walls, which is indigestible to the human body. When you eat raw food, first your digestive tract has to break down those cell walls, and then it can release the nutrients stored inside. By cooking your food first, you are helping to break down those cell walls to release the nutrients. So although some nutrients are lost in the cooking process, the ones that remain are more readily bioavailable to your digestive tract to absorb. You are making it easier on your body because it doesn't have to do the hard work of breaking down those cell walls. And all it has to do is simply absorb all of those good nutrients. So for the first month of the diet, or hopefully 2 or 3 months, aim for no more than 10 up to 20% of raw food. And you don't have to cook your food to mush. I'm talking about very lightly steaming your vegetables or having some stewed fruits. The warmer the food, the easier it will be to absorb. So avoid cold, raw food, avoid iced drinks, avoid anything that's going to make your gut cold. And instead, think of lightly steamed or sauteed foods, warm soups, casseroles, things that you would give to someone who is convalescing. You want to baby your gut. Even if your gut feels fine and you're not having any digestive symptoms, assume that there is some inflammation there and you want to reduce it as much as possible. And now we can tweak this diet even more according to traditional Chinese medicine principles. If you're suffering from what we call dampness in Chinese medicine, which means you are feeling brain fog, headaches, achy muscles, loose stools, or cough with a lot of phlegm, then you especially want to make sure you're not eating much raw food and you want to reduce dairy, sugar, and gluten. On the other hand, if you're suffering from what we call heat symptoms, such as anxiety, insomnia, heart palpitations, constipation, fever, and easy sweating, then you want to avoid spicy food, alcohol, and caffeine. And please remember, all of this diet advice is general, and you need to follow what your own body dictates. And if you have any questions, please do consult a nutritionist or a licensed acupuncturist to make sure that this diet plan will work for you and your needs. Okay, and the next step to treat any lingering pathogen is to rest. And this is probably one of the hardest steps for any of us to do. But I want you to think of yourself as a convalescent and give yourself the space and time to let your body heal. Even if you just try to take a break from as much as possible for 1 month, you will be surprised at the difference it takes. So I know we all have busy lives with kids and work and family and friends, but if you can postpone, delay, or just say no to as many things as possible for at least a month and maybe a few more if you can get away with it, and give your body the space to heal and rest. Go to bed early, take naps, meditate, relax. Your body is fighting all of this systemic inflammation, and it really does need a long time to heal. This is not a usual cold, and you do need time to take care of your body. So try to tell your family and friends and your boss and coworkers, if you can, that you just need a month, just 1 month, and then you can resume. And hopefully after that first month, you'll start feeling so much better that you can take a little bit more time if possible and give your body the rest it needs to heal. And the third and final step is actually one of the easiest, and that is to do some gentle exercise. Now, I know I just said you need to rest, but that doesn't mean just to lay on the couch all of the time. You do need to get some gentle movement in your body. And this is because the spleen, which controls the digestive tract, also controls the muscles, according to traditional Chinese medicine. And gentle exercise that gets a little bit of circulation going is one of the best ways to strengthen the body and to heal the digestive tract so that you have the resources you need to fight this lingering pathogen. So try to go outside for a gentle, slow walk every day, or do some restorative yoga or Tai Chi or Qigong. Make sure, even though you're tired, that you take the time to move your body a little every day. This will help keep your muscles flexible, and it will help strengthen your spleen and therefore your body and your immunity as a whole. And of course, please be sure to consider acupuncture if you are suffering from long COVID. Although it's too early in the pandemic to have any double-blind studies that show acupuncture's effectiveness on long COVID, we do have a number of studies that show acupuncture's effectiveness on other lingering pathogens, such as chronic fatigue. Acupuncture increases circulation and decreases inflammation. And if you can combine acupuncture with traditional Chinese herbs, that's an even better way to help fight the progression of this lingering pathogen. So remember our 3 steps, which is to heal the gut, to take the time you need to rest, and to do some gentle exercise. And hopefully you will be well on your way to healing your body and feeling like yourself again. Thank you so much.